when we get our labs back, we decide we're going to do treatment. What modalities or ways can we do treatment depending on the type of hormone that
Yeah.
we're replacing?
We have a couple different options. Currently, progesterone is only in a capsule form. I know there are studies that may have it in other forms in the future, but testosterone comes in the intramuscular injections in the pellet form that goes right under the skin, a small in-office procedure. Or we have troches, or it's also kind of a lozenge. It sits in your cheek and it dissolves once a day. And we also have compounded creams. So you'll apply those to the skin once or twice a day. And we can do testosterone and combination estrogen creams. For estrogen, that can go, or estradiol, that can go in a pellet, or there's an oral tablet form, just no injectable form currently. So about 4 to 5 different methods for getting optimized. There are pros and cons to each of them. Like for example, the IM injections, you're going to have that onset of relief probably pretty soon. And then before the end of the week, you're kind of going to be coming on that downhill slope. That's why it's dosed once a week. Pellets, in contrast, maybe take 2 to 4 weeks to kind of feel that full level of effectiveness. But the main idea of the pellets is to kind of flatten that bell curve. So that increase is not as directly straight up. It's more angled, but then you flatten that bell curve and you have longer at that optimized treatment level. 3 to 5 months is what you can expect for symptom relief with the pellets. Now, once we check your labs, get something going, we will recheck at about 4 weeks after that just to see, have we gotten any rise in your serum lab levels and have we had any improvement with the symptoms? So then after that recheck, we won't check for another calendar year. So in between there, we can adjust the dose, but essentially based on your symptoms. If you are not getting symptom relief, we can adjust the dose, or we can adjust the frequency, like the pellets. We may adjust how far apart you get your pellet treatments. So it's a very collaborative relationship. You tell me what's working well, and then we can make adjustments based on the symptoms as well.